Morning, welcome, and thanks to Zahid and the team at the Alliance for organising this event. I've known Zahid for 3 years now, I think it is, since he came into a newly created post at Scottish Government Support to provide capacity in the Alliance to take forward digital health and that citizen engagement. So it's great to see events like this happening, the Expo. I think we're really seeing that maturity now in what the Alliance can support and how they can help us in government create the policy and look at the solutions to take forward this important agenda. It's good to see so many colleagues from the third sector here to discuss how the sector will support implementation of the strategy, with the stress on collaboration. We're all here to collaborate. No one's got the solution here on their own. We really need to bring that together. So I thought that was a really good opening address from Zahid in stressing that point. Many of you will have seen some of the drivers for change, why we need to do things differently, why the current ways of working aren't sustainable. Scotland, in common with the rest of Europe, is seeing large increases in the age profile of its population, and this is bringing huge challenges for health and in the care sector. We see daily headlines about how unsustainable current care provision is, and some of the stats here highlight the increased demands on primary care, acute care, and really raise the question, how can we manage this system given the demands that are being placed on it? And together with the rise in that elderly population, long-term conditions prevalence is increasing. We're seeing particular rises in diabetes, hypertension, COPD, and that treatment consumes about 70% of the budget. So as the age-related long-term conditions increase, we'll need to consider new ways of managing those conditions, and digital technology, self-management, can provide some of those solutions. The widespread adoption of technology by people, businesses and public services requires government to provide direction, support, provide an infrastructure. So early last year, the Scottish Government published its digital strategy for Scotland, and its overall aim was that you can support any device anywhere in Scotland, so people are fully mobile. There's still a lot of challenges to geography, technology standards, public services, but the strategy is there. It provides a commitment, it provides a roadmap, and it's there to support our ambitions in health. So in health and social care, the Health and Social Care Delivery Plan and its other strategic documents set out a direction of care, direction of travel, and a very much an emphasis on people being at the centre of that. Prevention, self-management, reducing health inequalities are hugely prominent in the delivery plan and the supporting documents. But how do we do this given the challenges we're facing of increasing demand on services and constrained finances? Digital can provide some of the solutions which may help, but it's important to stress that just implementing technology, providing access to apps, isn't going to solve the problem. It really needs to be part of wider service transformation with technology as an enabler. And achieving such transformation isn't easy, given the large number of delivery bodies, some sitting at a national level, some at a regional level, some at a local level, and obviously a third sector that is hugely diverse, ranging from very small operators to national organisations. So I'll stress again collaboration. It needs a collaborative effort. To take forward our aims, we must collaborate. The problems are too big, too complex for one body to solve. Government can't solve it on its own. And the third sector plays a vital role here. As care providers, you're close to users, you understand their needs, and you're able to act innovatively and creatively. Alongside development of the digital strategy, we put together a international expert panel chaired by Professor David Bates of Harvard Medical School and prominent experts in the States, Europe, and here in the UK. And what that did was confirm much of our approach supported by the evidence that's there. Some of those key messages are the same: infrastructure, skills, workforce, and interoperability, of which Jeff will speak to later. And Parliament and the Health and Sport Committee undertook an inquiry and took evidence from government and a wide range of stakeholders. And some of the key findings were about a national approach, that we need to get better at scaling up, that we need to share data better and provide access to records and be able to contribute to those records. And underpinning that needs to be an infrastructure and a data platform that can move data around the system to make things easier, so we don't have the problems of individual silos not talking to each other. And so he touched on some of the feedback that came back from people. So we undertook an Our Voice Citizens panel specifically on digital health and care to find out what people thought. It highlighted some low awareness, but it highlighted a willingness to be able to access their records, some of the benefits that are there in rural areas for younger people, and also that people wanted to use digital in the way that they embed it in other parts of their daily life. So huge benefits to the people for digital health and care services, which ultimately led to the person-centred vision in the strategy. It's at the heart of the strategy. It commits us to providing access to information, tools and services to help people maintain and improve their health and well-being. We need to avoid the errors of the past of designing systems without involving people in the participation of that. So also highlighted in the strategy is embedding the Scottish approach to service design. So we'll ensure that participation is there from the start and that services will meet people's needs, and hence we'll have a sustainable service model. So the strategy was published in April. We're now here in September, just at the start of September. You may ask what's happened since then. Obviously there's been summer recess and a bit of a slowdown in activity in that period, but there's been a lot of work behind the scenes. We set out domains in the strategy, individual work streams, and service transformation is part of the agenda for today. So we've been planning how to take forward each of those domains. We've established a national decision-making board which met last week, which provides overall governance. And each of those domains will provide opportunities to help influence the work going forward. So if you do have the opportunity to participate, I'd encourage that. Participation is what we're looking for. So as well as those work streams, I've been discussing with Zahid that we have an independent third sector grouping that helps influence all of those domains. So I'll maybe touch on that today. So I don't want to take up any more time because there's lots of material to get through today. So here are some of the ways you can engage. Please get involved. There's a number of channels to communicate and contribute. And thank you again. Thank you for Zahid for organising this. And I hope you enjoy the rest of the day. Thank you.